You arrive on scene for a patient who is extremely agitated, yelling, sweating, and pacing. They appear unusually strong, confused, and may be removing their clothing or acting aggressively. This situation may be excited delirium, a life-threatening medical emergency. And clear. So ideally we may Excited delirium is a condition characterized by severe agitation, confusion, aggression, and extreme physiological stress. Patients experiencing excited delirium are at high risk for sudden cardiac arrest if not treated quickly. It often is associated with stimulant drug use, especially cocaine or methamphetamine, but it may also occur with severe psychiatric illness, head injury, or metabolic disorders. Common signs include extreme agitation or violent behavior, confusion or inability to communicate clearly, profuse sweating, unusual strength or resistance to pain, rapid breathing and heart rate, hyperthermia or very high body temperature, removing clothing despite the environment. These patients may appear exhausted but unable to stop moving, which places severe stress on the heart. Your first priority is scene safety. Patients with excited delirium can be unpredictable and may require law enforcement assistance for safe control. Request ALS early, as these patients often require sedation and advanced monitoring. Once a patient can be safely approached, perform a primary assessment. Focus on airway, breathing, and circulation, and look for signs of hyperthermia and severe agitation. Provide high flow oxygen if indicated and monitor vital signs closely. Avoid prolonged physical struggle. If restraints are required, they should be applied quickly and safely following local protocol. Once restrained, place the patient in a position that allows for adequate breathing and continuously monitor their condition. Never physically restrain a patient and place the patient prone. Excited delirium is a true medical emergency that can rapidly lead to cardiac arrest. Early recognition, maintaining scene safety, requesting ALS, and rapid transport are critical steps in improving patient outcomes. Calm communication, teamwork, and constant monitoring can help protect both the patient and the responders.